I'm Jigger Balisa from BSN 1A, and today I'm going to do the administrating of oral medication. So, first assessment is assess the client allergies to medication, client ability to swallow the medication, presence of vomiting or diarrhea that would interfere with the ability to absorb the medication, client's knowledge of and learning needs about the medication, perform appropriate assessments specific to the medication. So, gather the equipment. So, first is our medication card, medication tray, medication glass or medication dropper, then pill crusher, straw to administer medication that may discolor the teeth to facilitate the ingestion of the liquid medicine, then towel or napkin. Know the action, special consideration, dose ranges, purpose of administration, adverse effect of medication to be administered, check the medication card for the doctor order sheet, to the client chart, clarify any inconsistencies. So if you're not sure about the medication and cannot read the medication on the medication card, we should check the orders of the doctor. Then wash hands and observe other appropriate infection control procedure. Then I already washed my hands. Then assemble and arrange the equipments needed in a tray. So here we have it, our equipments needed. So prepare medication for one patient at a time. So read the label of the medicine 3 times, each time checking the medicine card. So first, when removing from the medicine cabinet or from the patient medication box. So we should check it because sometimes there are medication that are expired. So if it expired, discard it or return it to the pharmacy for them to recheck it. Then B is for before pouring the medicine and check if it's the correct medication. Then compare it to our medication card if it's the same. Then when returning medicine to the cabinet. So for liquid medication, first thoroughly mix the medication. Shake the bottle containing the liquid medicine before pouring. Okay, here we have it. Shake before pouring in the medication glass. Then discard any medicated that has been changed or color or turned cloudy. So check. So I think it is normal pa, hindi cloudy or anything. Remove the cap and place it upside down on the countertop. So upside down to avoid microorganism to go on it. Then hold the bottle so that the label is next to your palm and pour the medication away from the label. Then hold the medicine glass at eye level and pointing thumbnail to the level of desired amount. So desired amount, put your thumbnail, desired amount. Then before that, let's do it. Put it there. Then put medication glass. Then before keeping the bottle, wipe the tip of it using a paper towel. Then score this, then recap it. So, acid and medicine containing iron should be given through a glass tube followed immediately by water. Cough medicine should be given undiluted and followed by a little or no water at all. Liquid medicine should never be poured from one bottle to another bottle. For tablet or capsule, place the pack in unit 1 dose capsule or tablets directly into the medicine glass. Do not remove the medication from the wrapper until it is bedside, okay? So, make sure not to touch it, okay? Put it back, then if using a stock container, pour the required number into the bottle cap, then transfer the medication to the medication glass without touching the tablets. Then break score tablets only if it is necessary to obtain the correct dosage. Use file or cutting device if needed. Then, if the client has difficulty of swallowing, crush the tablets with a mortar and pestle, then mix a small amount of food or water. So, letter E, separate medication that needs a required specific assessment such as blood pressure, cardiac rate, and respiratory rate, and pulse rate. So, there are medication wherein before we administer the medication, we should check the BP, especially for anti-hypertensive, because if the BP of the patient is less than 120, we can give the medication, but we should refer to the resident's duty or the physician. Then, recheck if the medicine package or preparation with the order as it were. Then, when all medication from one patient have been prepared, recheck once again with the medication order or the medication card before taking to the patient. Carefully transport medication to the patient bedside. Keep medication inside at all times. So, administer the medication at the correct time. Take the medication of the client within 30 minutes before or after the scheduled time. So, in our medication card, we are going to administer the medication 8:30 a.m. So now it's 7:45 a.m. So it is the correct time. Then identify the patient carefully. There are 3 ways. First is check the name of the patient identification bracelet. Ask the patient for his or her name. Third is verify the patient's identification with the staff member who knows the patient. Then complete necessary assessment before administration of the medication. explain the purpose of the action of medication to the patient. So now, ma'am, I'm going to give your medication. It is for your health. So, what is your name po? So, okay, the medication that is given to you is 500 milligrams fluoxacillin for your antibiotics. So, place the patient in sitting position if not contradicted, or place the client's head near the edge of the bed. Pwede ka po, ma'am, umupo. Okay, then, place a napkin or towel under the chin of the client to, kasi sometimes there is spill from the medication, so it's necessary for us to make sure that it is clean. Okay? So, place it under your chin. Then, administer the medication if the client is unable to hold the patient's medicine glass. Assist the client by introducing the medication into the client's mouth and give only one tablet or capsule at a time. If the medication has an objectionable taste, ask the client to suck a few ice hips beforehand, or give the medication with juice or bread if there are no contradictions. Then, okay ma'am, this is your medication po. Get it na po. Ikaw na po kumuha. So, okay, swallow it po. This is your water. Then, remain with the patient until each medication is swallowed. Okay ma'am? Nasalo mo na po. Okay, then, return the medicine card to the proper place after use. So, here, we have it. Then, ma'am, thank you. Then, clean the used equipments with soap and water and dries and return to the placement. We already clean our used equipment with soap and water, and we already return it to the proper place. Then, record each medication given on the medication chart or medication on sheet. Then, first, record the medication given to the patient, the dosage given, the time of medication, or any complaints or assessments of the client, and your signature. Then, if medication was refused or omitted by the patient, record this fact of the appropriate record, document the reasons, when possibly, and the nurse action according to the agency policy. So, it is important that after the medication, we should document, place the time, and our signature. If the client refused, report to the nurse's note, then, and the client reason kung bakit ayaw niyo yung i-take. Then, clean and reassess the patient after 30 minutes. So, we're going to go to the patient again after 30 minutes to check to check and verify the response of medication to our patient. So, hi ma'am, I'm back again. So, I'm going to recheck. May na-feel ka pang pangangate after taking the medication? Sumakit na ulo mo? Okay, nasusuka ka ba or sumakit siya mo? Hindi naman. So, okay naman pakiramdam mo?
Okay.
Okay.